Hey, Dr. Vinnie, good to see you. So, for medical students or just others who want to know how a family doctor's call on a New Year's weekend goes, here it is. So, I started at 8 a.m. on New Year's Day, which was yesterday, and got my first page at 8:04 a.m. And that was, it was jaw pain and went from there. And then I've had about 28 pages since then. And right now it's midnight on Sunday, and I'm going to go all the way until 8, probably 8:30 a.m. Monday morning. And my clinic starts at 8:30 a.m. So I'm on call all the way from 8 a.m. Saturday morning till 8:30 a.m. Monday morning. Start my clinic, and then clinic ends at 6:30 p.m. because Monday is my late day, and then I probably won't leave the office until 9:30 because there'll be charts to finish, test results, and those usually will probably be quite a bit. Patient messages from emails, and then patients leaving messages with the nurses, and those will be funneled over to me. And then, of course, treatment or medication refills, prior authorizations where doctors need to authorize a medication. So, what kind of stuff did I get to see this weekend? Out of the 28 pages that I received, I would call the patient back, or sometimes I would do a video visit with them. So many times it was a rash, a lot of COVID, of course. So coughs, shortness of breath, chest pain, tightness in the chest, fevers, people who wanted a COVID test, people who already were COVID positive and didn't know what to do because they were still short of breath or having fevers, or were coughing quite a bit. And so a lot of things with COVID. Few people were vaccinated. A lot of them were unvaccinated. So it just kind of ran the gamut. And then there was quite a bit of people who just had nothing to do with COVID. It was rashes and foot pain and back pain. So any type of pain, and so you take care of that. We had I did have a female who was pregnant with COVID, and that's always a dicey thing to take care of. So I wanted her to get a hold of her OB as well. And so we had that, diarrhea, anxiety, a 90-year-old who was feeling very weak and hadn't eaten for like 3 days. So that person had to go to the ER. Stuff like that. So, you're going to get those type of calls. Home health wanted to speak to me about some patient orders, and then the emergency room wanted to call and talk to me about a patient that they were going to send home, but they wanted to make sure that there was going to be a close follow-up for that patient. So those are the things that you're going to get called about. I'm pretty exhausted right now. So every time I thought I could get a 15 or 20-minute break, that pager would go off again. And each page, I would have to get on the computer and document this, and talking to the patient. Some of those would be short calls, maybe 6 minutes, and some of the video visits would be 8 to 12 minutes. And one was, the patient just wanted to talk, it went for a good 18 minutes, and I just let them talk. But then my documentation needs to happen as well. So I would, documentation and chart review could be another 8 to 10 minutes. So you're spending a good amount of time, and if you multiply that by 25 patients, and the night's not even done. Last night, my latest call was at 3:55 in the morning. That was kind of brutal, and so not much sleep, but it's just part of the gig. You kind of do it, and you get used to it. So that's just the way it is. Especially with COVID. Nothing compared to what I had to do last year, which was when COVID first started in 2020. that was absolutely brutal. No one knew what the hell was going on. Patients didn't know what to expect, what symptoms were COVID. And let's face it, many physicians didn't either, but I couldn't even leave work. I mean, I was getting paged second after second after second. I actually had to call my coworker and say, listen, can you just take 3 of these pages I just received so I can drive the heck home from clinic? Because I need to do the 20-minute drive. And then didn't have time to use the restroom, eat, shower, anything. I mean, it was page after page after page. I think I must have had 36 to 40 pages between 2 p.m. on a Saturday till 8:30 on a Monday. And it was ridiculous. Hey, so it's Monday night at about 9 p.m. and got home from work, gonna eat dinner soon. And let's see, I had 2 more pages. So last time we spoke, which was midnight and on Sunday, I had 28 pages. Well, I had 2 more. So I had one at 4:17 a.m., which was fever, vomiting in a 3.5-year-old, I think it was, and then 6 a.m. for ear pain in an adult, and that was a negative COVID patient. So I was going to wake up at 6:20, so that kind of blew that. I might as well just stay up. And then I got to work early and started doing some paperwork, and then clinic started at 8:30. And then I got home at around 9 because I had to stay and do test results and patient messages and emails from patients and refills. And yeah, so going to wind down and then, go to bed and start on Tuesday again. So, it was a hard call. It was 30 pages this weekend. And let's face it, a lot has to do with COVID. If it wasn't for COVID, I usually don't get that many pages. But that's just part of being a doctor and part of having a pandemic, let's face it. So if it was an easy job, it wouldn't be as satisfying, and not everyone can do this job. So it's actually pretty rewarding, and patients are very appreciative, and trying to figure out what's going on with patients and making the diagnosis is you're like a detective, and I kind of get a thrill out of that when you make the diagnosis and figure things out. So it makes your job interesting. It's definitely not a mundane job with family medicine. So if you like the video, subscribe, like, and Dr. Vinnie signing out. Take care. Bye.